Which couples are at higher risk for having birth defects in their newborn? First is older couples, women older than 35, men older than 50, 55 are at higher risk for getting a congenitally abnormal baby. Second is consanguineous marriage, where couples have any kind of blood relationship. We know that there are, in many communities, there are marriages between cousins or close relatives, uncles, etc. That is a risk factor. Anyone who has had a previous history of abnormal child or abnormal newborn, they are at higher risk, although to get a normal baby perfectly after one abnormal is also very high, but they need to be aware that their risks are slightly higher. Then there are some abnormalities which run in the family. They are genetically carried, like Down syndrome, fragile eggs, Turner syndrome, Klinefelter syndrome, Duchenne's muscular dystrophy, etc. So it's very important to know your family history on both sides, if there are of any birth defects, and then inform it to your doctor. Other than these, there are some professions which carry a professional hazard, and so they are at higher risk. For example, people working in the industrial area, especially printing and dyeing kind of factories, which can have a detrimental effect on their growing newborn. Then radiologists, X-ray technicians, those who work in the X-ray units, they are at high risk. Doctors who are anesthetists are exposed sometimes to inhalational anesthetics, so those people are at higher risk. Dentists. So these are some professions other than industrial workers who are also at higher risk of having any kind of certain kinds of anatomical abnormality or morphological abnormality. So they have to be careful, and they have to investigate a little further. These are the risk factors which a couple should be aware of and report it to their doctor.